If you're having your prostate removed, there are a few things that can dramatically change how well you recover, but most men aren't told about this until after surgery. As a physiotherapist who works with men before and after prostatectomy, these are the things I wish every patient knew before walking into the operating room. My name is Brad. I specialise in men's health and prostatectomy rehabilitation. My goal is simple: help men recover faster, regain their confidence, and get back to living their lives. So your recovery starts before surgery. And what I mean by this is when you have a good baseline of fitness, you generally tolerate the surgery and rehabilitation better. So that means walking regularly, doing some strength training a few times a week, and having good nutrition. Patients with better fitness generally tolerate surgery and rehabilitation better. So you might have started pelvic floor training, but you do need to make sure that you're coordinating the muscle contractions properly and not just focusing on the back of the pelvic floor muscles, but also the front pelvic floor muscles. Once you're able to coordinate the correct pelvic floor muscles, we look at the strength of the contractions and also the endurance. So looking at 100% contractions for X period of time, and then the length of the contraction as well. Thirdly, it's important to set realistic expectations post prostatectomy. The initial days post-surgery, you will have urinary incontinence. So you will require pads for the first few weeks as we start to build your pelvic floor muscle, and also you start to build into more functional tasks that require you to then contract your pelvic floor. So 99% of prostatectomy patients will have some form of urinary incontinence, but then 98% will make a recovery. The vast majority of patients post-prostatectomy will require some form of pelvic floor rehabilitation, but there is a small percentage of patients who may respond quite well post-surgery without any pelvic floor muscle training. Then on the other end of the spectrum, there's a small percentage of patients who may not respond well to physiotherapy at all. And we can discuss further down the track what interventions they may require. Have a recovery plan. Most men spend years planning for retirement, weeks planning for a holiday, but then only minutes planning for their surgery. So it's important that you set realistic goals depending on the type of cancer that you had and what type of surgery that you had as well. So whether that was a nerve-sparing surgery or non-nerve sparing. And lastly, recovery isn't just physical. It's also psychological as well. This surgery can affect your confidence dramatically, your identity as a man, intimacy with your partner and what that may look like in the future, and then also fear. Fear of going out in public and what might happen in certain situations that you might be sort of compromised in. All these factors to think about post-surgery. If you've got prostate surgery coming up or you've already had it, subscribe, because every week I'll be sharing practical advice to help you recover with more confidence.